Dr. Pierce, thanks for coming in. You were at the game yesterday, and, David Montgomery came back to play in the game.
Right.
After
Not
he
much,
left the
though.
game. Not much,
Yeah.
but nonetheless, he did come back into play. It's been revealed today he's got a torn MCL, and he will require surgery. That's a tough one. Between him and McNeil, those are two tough ones. Lee McNeil torn ACL. Just a tough pill to swallow.
Yeah. I mean, it's, we said it last year how we did so well because of the lack of injuries and everybody was good. And this year it's like the polar opposite. But they keep coming through. I mean, I don't know where you want to go right now. I mean, the MCL, Montgomery, I want
to go wherever you want to go first.
I mean, Montgomery's one of, obviously the most concerning of it all. Is an MCL like an ACL? And that's kind of what I think the viewers would want to hear about. The MCL is the medial collateral ligament that creates the stability, that side-to-side movement. And can that be braced? Can you get by without one? You're more likely to get by with a repaired MCL quicker than you are than an ACL. ACL just has more responsibility to the knee. I think we do have it. So right there, you're starting to see on the video, that's the ACL. So that's the one that's internal. And here we are, we're pulling back out. The one on the inside of the knee, which is the closest to Maz, is the MCL. So that's a much thicker ligament, which is harder to tear, but it's easier to repair because there's a lot more anatomy around it. So, I mean, just to back up a second, here's the anatomy as we're pulling it off. You have the knee, the patella, and then you have the ligaments on both sides of the knee, the inside and the outside. Which one is the medial collateral, the other is the lateral collateral, and then the ACL and PCL in the middle. So not to confuse everybody, right now you're seeing the anatomy of the ACL, which is more McNeil, where we were tearing, where that's the one that we used to think was a kiss of death.
He knew it right away, too.
Yeah.
When he got hurt, you saw him. He was so upset.
He was pounding the
ground.
ground.
He knew he was done.
Yeah, so it's just that.
How do you know at that moment that it's your ACL?
He knew. I don't know if he knew it was his ACL. He knew it was bad.
Yeah.
Okay, they start with bad, then they worry. They know ACL, which is the most common thing that they know, and he's probably figuring it out that blank that I tore that. But basically, just to get back to Montgomery, it's the MCL, which is the inside of your knee. If we can show it's a ball. It's it's a joint that kind of comes into each other. And it's on the inside of the knee. So typically we can see recovery quicker. The thing is we're running out of time until the Super Bowl. If he has repair, he can have a quick repair and then some of that secret sauce on there to speed it up. But he's such a lateral, pivotal player.
Yep.
It's just so key. And like you said, the actual injury when it happened didn't look like much. It looked like a normal tackle. He kept playing on, which he could have made it worse, and these guys are tough. And they're putting 110% out there, and what's going to happen? He's going to repair it this week, and we'll play it week to week. Is he out for the season?
That's what they say.
That's what they're saying.
Dan Campbell said it today at 3 o'clock at his presser. He's like, it looks like they were going to get a second or third opinion, but he said it looks like Monty's going to need surgery to repair this, and that would put him out for the year.
Yeah, I mean, I don't want to put my 2 cents in because, I mean,
I said they should have at least checked you out for some sauce first before they decided to go on surgery.
The thing is, you can play with a brace with that. There are other options where the ACL, you don't have much of an option. With an MCL, there's some options, and the thing is, they're so powerful and strong, depending on how much swelling was around it. There's other factors that go into it. I trust the team, the physicians, and if they're saying, he needs surgery right away to repair it. In the old days, they would let's get through the season and we'll deal with it. Let's brace it. Let's do everything we can. Today's a bigger business, a long-term thinking, and it's not like the ACL where you're down, you're done, because you cannot create any stability. With an MCL, you can create alternative stability with that injury. So that's the most I want to say.
Dr. Pierce, let me ask you about both of these players, look, they're out for the year. What is their prognosis moving forward? I mean, McNeil with the ACL just signed a 4-year, $97 million deal. Montgomery signed, I believe it was a 3-year extension.
Yep. They're not going anywhere.
They're not going anywhere. But in terms of their peak performance, peak athletic performance, where do we believe their ability goes? Is it taken down a notch, or are these surgeries so routine these days that there should be really no concern?
Again, you're talking about athletes that are committed. They do have contracts in front of them. I don't know if they have to show, if they have to play. I mean, there's all that, other factors that may motivate. As far as the purity of their sport, I've always said these guys will come back when committed even stronger, as strong or stronger, because they're going to work even harder on their mechanics, on their strength recovery, on everything. Especially if we do say they're both down now and we're worried about the beginning of next season, there's plenty of time. It's the magic 6 months. We have enough time to get them to peak performance. Can Montgomery lose a step? He may lose a step, just like when we talk to Braylon when he's here after his ACL. I learned the game differently, right? That's my interpretation. I'm fixed. I'm there. I need to play differently. Look at JMO. I mean, he's got a torn ACL. Anybody talking about that injury? Is he hesitant on that knee? Is his first step slower? No, I think the guy committed and became a better, mature athlete on the field. I won't say what he's doing off the field. But for both of these guys, Montgomery for sure, McNeil I think has the same standard, same montage or the Kobe method. I want to come back. I want to do it bigger and better. So my prediction is, McNeil's out for the season. He's coming back just as stronger, just like JMO. He needs to get that feeling of that proprioception. I can come on the field and do it. He's not as he needs those short bursts and that strength. He'll create strength from the other parts of his body to compensate. Montgomery is there also.
You've been around for a while, just like me. You've been around teams a lot more than I. Have you ever seen a professional team hit with as many injuries as this team?
I've been asked that over the weeks, and now I think I officially say the Lions have beat everyone else out. I've never you guys know sports and history better than me, but from a medical standpoint, which we follow more, no, this takes it. I think they've broke the record. Is there a record? Do we even know the stats?
They got to have it.
We got to have it.
They got to have it. I heard the Green Bay Packers, when they won their Super Bowl against Pittsburgh, Aaron Rodgers' only championship, a lot of their guys were out as well. Maybe they had 12 or 13 guys on the list, but not 20.
I think we broke 20 now, didn't we? Yeah. Or McNeil's a double? Do we count him twice because it's two different injuries?
I don't know. We're going to get Anzalone back in 2 weeks. How is he going to be coming back with the forearm?
He should be fine. We predict he's fine, but I've heard he's struggling a little bit. Some internal news that he's struggling a little bit with the recovery.
Now, what would cause that?
I don't know if it's a mental recovery. I think there's that mental toughness because the bones heal. We'll do bone stimulators and the secret sauce and all that stuff, but like my guy who coached Little League football, he's like, we usually just cast them, wrap that cast, and they're back out playing. What's going on here?
Right.
So I think
that's what I originally thought was going to happen. I even wrote you when it happened. I'm like, right. Can we cast him and can he play in 2 weeks?
I think we got to the point we don't really need him. Let him heal properly. Does the Buffalo game switch our attitude? I think we came up against a really good team. We didn't play our best, and I think, like you said, can we run the rest of the games? I think we can, with our 80% team getting ready for playoffs. But McNeil with an ACL, I'm sorry to say that that's just not going to happen. Montgomery, I wouldn't count him out just yet because there's other things, there's other options, there's holistic, there's non-surgical. I don't know exactly. I could see the amount of tear because first it was a sprain, to a partial tear, and now we're reporting it's a complete tear. Complete tear is a different story.
Carlton Davis fractured
His jaw.
Yeah.
Broke his jaw.
I'm not even sure how that happens. to
like
be
you
honest
said,
with you. And I'll tell you this,
it might have
much,
been a
too.
forearm.
It might have been a forearm, but these players don't wear their freaking mouth guards anymore either.
No, they don't.
Would that have helped?
Would that have helped?
Depends on what happened. I mean, ideally, if you're wearing a helmet, it's protecting your jaw. So it had to come up from underneath. And if you were at the game or watching the TV, you know, those piles, I saw a lot of UFC forearm smashes to the face and to the helmet. A lot of stuff going on, which I didn't really see in other games like that. There was a lot of hits after the fact. So if we could pull, I didn't see the actual injury. We can see it. That's something else.
I think it was a helmet to helmet. Like that's what I originally thought it was.
Yeah, the mouth guard's there to protect the jaw and your teeth mostly. So it will, but it's not like if you have the right hit, it wouldn't have made a difference if he had his mouth guard or not. With a fracture, it was a pretty significant hit to right forces and vectors that we talk about.
Talking to Dr. Jeff Pierce, Michigan Sports and Spine, our WSN injury insider. What do you make of all these ligament injuries? And they seem to happen at home a lot.
Yeah, I mean, you can talk about turf, you can talk about strength and conditioning. I mean, we could have a whole show on that, so I don't know how deep you want to get into that. Everything's playing a factor. I still want to go back to the purity of the game. If these guys are going 110%, they're creating a higher level of collision. They're throwing their bodies into things. Where are they creating a higher risk? I think they're creating a higher risk.
Sure.
McNeil, I don't think they did anything. Montgomery got tackled. He wasn't trying to, fly around, spin around, jump over anybody at that moment, even though he's been doing it this season. But at the time of that injury, it was a normal football play. So I don't know. I don't know if it's just bad luck, bad karma. I cannot. I mean, I'm the first one to go point to one thing that's causing all this, and can't find it.
Khalil Dorsey, who replaced Carlton Davis, it was friendly fire, and I don't remember the Lion player that swung around. Remember how Aiden broke his leg? Someone's leg snapped around and got him. Same thing happened on this guy, except lower, and it was his ankle, and he knew right away. And Dan Campbell, the minute I saw Dan Campbell out there inside of the first 10 seconds, I knew it was curtains for Khalil Dorsey, and that sucks. I don't think the broadcast yesterday that CBS had was any good. They hardly showed the injuries. They weren't talking about it. Romo was too busy foaming at the mouth over Josh Allen, and Hello Friends didn't have his best game. But I don't know, man. It's hard. Aiden Hutchinson is healing, as you've been following him.
I was going to ask you about him.
He's healing up.
Just what are you hearing about Hutchinson and?
Hutchins, like we've said, I mean he's ahead of schedule. He's doing everything right to the T. He's focused. He wants to get back. In the back of his head, is he thinking, I want to be in the Super Bowl? Yeah, I'm sure it is. But again, to push the anatomy, I keep using this silly analogy, even though you want your pregnancy to end before 9 months, it still takes 9 months to do it properly.
Right.
So it's the same kind of thing. We got to have that time frame. Is he ahead? Yeah, is he ahead? Is he doing everything right? Yes. It's everybody. It's like we got 5 players returned yesterday. 1 went back. I mean, we're slowly getting the 18 guys slowly back, but we can't keep adding to it.
No, that's a problem, and you hope you can cut it off here, because if I told you that yes, of course Hutchinson and McNeil and Davenport are out, bad, yes, but you're still rolling out there with who's the guy from Cleveland?
Do you know he only played 44% of the snaps yesterday?
Zadarius Smith.
I don't know what happened.
DJ Reader, Levi Onwuzurike, and Josh Pascal. Still very, very decent. Did
you see that Pascal hit on Josh Allen?
Yeah, I did.
Holy crap.
I did. You were in the building yesterday. Final thing, what'd you make of the onside kick with 12 minutes to go?
I needed the rest of the day to go over that. I mean, I'm medical. I don't. Someone said there's a point between aggressive and reckless.
Yeah.
I don't see how that's it's not defined as reckless. Like, what were you thinking? I don't get it.
We were talking earlier. I think it's fine if they don't return it to the 4.
No, I don't think it's fine at all.
Do you understand that they had to take chances, Doc?
Right?
Doc, they weren't stopping.
Was that live?
Yeah.
Yeah.
Listen, you're a doctor. They weren't stopping a nosebleed. Okay?
Right.
They
We
would've
said we weren't stopping.
They would have scored anyway. You understand? If they got the
No.
ball at the 30, the 50,
And they would've
or
lost
our
time.
30, they would have scored anyway because
lost
they
more
didn't force
time.
a punt all second half. So you take chances and you try to shorten the game and steal something away from Josh Allen and keep him on the bench. I don't have a problem with it.
So basically, you never thought you would get the onside kick. You just wanted to take less time for them to score.
No, I thought we could get it. They wouldn't
What?
have done it. Listen, they wouldn't have done it had they not been practicing it. And Ryan made a point. That was an amazing kick. It did what it's supposed to do.
Yeah,
It
bounced
jumped-
right into his hands.
It jumped over the first level of guys. Our guy was right there, ready to grab it, but the Bill was there as well. He was a higher point. I just watched it again. And you know what? You don't know how close it was for us getting it.
We allow the 4th down things
All right, I'm
because
done.
statistically,
I'm done with you.
because statistically, the 4th down we're getting percentages. What's the stats on onside
10%.
kicks? Not even 10%.
Not
It's lower
even.
than that. Yeah.
I think it's
only been
1.2%.
I think it's only been 2 recovered all year.
No, it's 1 by the Bears.
Oh,
by the Bears,
gosh,
No, not
incredible.
one.
yeah. By the Bears, yeah. That's the only
It's
one
like
this year.
minimal.
Might be only 1.
12
Well, you got to
minutes.
announce it. You lose the element of surprise.
Next year, that changes.
Absolutely.
That changes.
What, the onside?
Yeah, it goes back to the old way. You cannot
The
do it this
kickoff,
way.
yeah,
This way
it's
is a
weird.
complete, it's a joke.
Well, it is a
Announcing?
joke, but it's part of the game. It's,
No, it's not part of the game. It's the first time they're trying it this year. Oh, we're going to do an onside kick. Oh, Joe Blow has got to come in. And you remember the whole thing against the Cowboys last year with Dan Skipper. By the way, Skip, great touchdown.
Unbelievable.
By you. I hope
Oh,
you
yeah.
threw up
Unbelievable.
yesterday perfectly as well. The NFL has to go back to the old kick again. Just penalize
they're
the team.
reducing injuries, which the Lions have not proven to reduce injuries. But no, I'm sorry. We have to second guess it. I mean, even if it went well, if we got it, why didn't he do it the next time?
He should have.
Just kept doing it until we
Yes.
just keep doubling down until
Yeah.
we win.
Yep.
I've
Yep.
heard that in a movie or two.
All right. At that point, you weren't stopping anybody, anything,
Yeah.
Why do we have such a lack of defense?
because we don't have anyone left. Our best defensive player went out in week 5 or whatever the hell game that was against the Cowboys.
But we've still been holding people back. Anyhow,
Linebackers.
it just showed no confidence in your defense
Well,
No
yeah,
doubt.
nor should he have any. Yesterday.
yesterday.
You
I don't-
lost
are
2
we getting-
corners and a linebacker.
Did we lose the game or did the Bills beat us?
Both.
The Bills outplayed us, most
Yeah.
likely. And still, you lost by 6.
And they had 2 safeties out that was such a big deal. You know, we want to talk about their injury report.
But listen, David Montgomery went out early. So that changed the whole game plan.
Yeah, Montgomery
because
being out
Green Bay,
quietly.
because Buffalo was terrible against the run, yet we couldn't use our game plan. Once
Attention
Monty
sports
went out,
fans, don't miss
it
out
was
on
all
Expert Sports Injury
blown up.
Insight with
The
Dr.
game
Jeff
plan
Pierce
was
of
blown
Michigan
out.
Sports and Spine. Join Dr. Pierce every Tuesday during Big D Energy and Thursdays during Ermanni and Edwards, where he offers top-notch injury advice. Trust the guy that I trust. Dr. Jeff Pierce is here to keep you in the game and performing at your best. For more information, visit MichiganSportsandSpine.com or call 248-426-9944.